Well, now, since the outbreak of COVID-19 in Ghana, many organizations and individuals have gone out of their way to support the fight in various ways, from funding the production of PPEs and hand sanitizers to the production of critical drugs. On the post today, we put a spotlight on contributions of these entities. Today, we're focusing on Tobinco Pharmaceuticals. It's a company that's first to begin the production of hydroxychloroquine to help treat patients after the outbreak. Joining me in studio is Christopher Mensah, Deputy Managing Director for Tobinco Pharmaceuticals Marketing. Mr. Mensah, you're welcome to the show. So, hydroxychloroquine is one of the things that you started production. You're the first company to start production in Ghana?
Exactly.
See, how difficult a road is it to take?
Right, thank you very much. So, hydroxychloroquine, we produce it as a generic medicine.
Okay.
To say that there's an innovator, somebody had it already out there somewhere in France.
Okay.
And then we decided that, you know, in Ghana, let's do something to support. So we looked at the product, looked at the product parameters, and then decided to manufacture same.
Okay.
It's not that easy, especially for a product whose formulation you require a lot of scientific background to be able to do. Because when it comes to pharmaceuticals, it's not just photocopy, copy and paste, because mixing of medicines, A plus B is not the same as B plus A when it comes to formulation. So it's been a long fight, but fortunately, with the support of various stakeholders, we've succeeded, and here we are with it. Okay,
does it give us as Ghanaians, seeing that Tobinco is a Ghanaian company, does it give us any special edge over other countries which have not been able to produce some of these drugs needed for coronavirus?
Right, yes, so it does, especially for us in Africa. You realize that as corona started hitting globally, various countries were calling upon their various manufacturing facilities to boost up capacity. And for us, the government called all pharmaceutical industry players to do something to support. So the sanitizers came in, and along the line, this product also came in. For now, as we speak, we are the first company in West Africa to have produced it. So for as long as this drug remains relevant or critical in the treatment of COVID patients in Ghana and elsewhere, we have the chance to export it to these sub-regional countries around us.
So talking about exports, what strides have you made in that regard? Where are we now?
Right, so Entrance Pharmaceuticals, which is the manufacturing subsidiary of Tobinco, is actually the biggest pharma manufacturing facility in West Africa. Okay. And already we have, we've made inroads into a number of African countries, and we are still growing. So these countries that we have partnerships with already, they ask us, can we support them, can we give them, and all that. So as we speak, we have lots of orders from various countries around us already. Only that we need to focus on our country and support our country first before we can look at exporting some to them.
Can't you support other, like NS Chemists, like all the other organizations to come together as a bigger consortium that can then produce this? And if you have to export. So we do that and then we get the money.
Sure. So we have very close working relations as an industry, as the Pharmaceutical Manufacturers Association of Ghana, PMAC. So we deliberate on lots of all these things, and we share knowledge, we share expertise. So definitely they are also coming up.
Okay.
So as and when we get there, but let me quickly say that Entrance has a huge capacity. It was actually set up to manufacture to meet the African needs.
I said that because you indicated that you wanted to, meet the demand in Ghana first.
Yes.
And I'm saying that if there is the demand beyond Ghana and there is the capacity to produce to meet it, why don't we mobilize that capacity to deal with it?
So we have capacity for Ghana and beyond. That's the capacity. Okay. But for the first batch that we produced, yes, that was what we were talking about. Okay. Immediately, we donated a lot to the Ministry of Health to be able to take care of patients at the treatment centers first. Right. And then for them to have experiential use of the product, even though it is FDA approved, so that we can build some more data locally as we look at the export market.
Interesting. So far, what has the feedback been? I think that's the hydroxychloroquine. Yes. You brought some to show us, right?
Yes,
okay, so this is how it looks like, and this is Entron. So you work together with Entron. So Tobinco works together with Entron to
is our subsidiary.
Okay, so you're leaving this with us, right? So that if we know friends who have coronavirus and they're very sick, we can share with them.
Unfortunately, it's a prescription medicine.
Oh, right.
So
so you can't just walk over the counter
get into a pharmacy and get it over the counter.
So for those of you who are watching, here is it. So this is produced in Ghana.
Exactly.
Okay, this way it should be. So hydroxychloroquine produced in Ghana, and Tobinco Pharmaceuticals is the first to do so. Okay, so you are essentially looking to export, and I'm looking forward to that particular day. But dexamethasone is another drug that has been identified as one of the most effective drugs for very sick people. Is that something you're looking at as well?
Right, thank you. So we have dexamethasone injection already in-house. Okay, it's a tablet form that as and when we get more evidence and solidity that is something that can be useful locally, yes, then we can go into it. But for
at this point, we're not sure.
You know, for the protocols of the treatment protocols of Ghana, that is what we fall on.
Okay.
For now, they have other medicines that they use in place of the dexamethasone to manage that critical end stage. And hydroxychloroquine is still so important in a treatment protocol, especially from the mild to moderate cases. The dexamethasone usually will come to the end stages where the patient's systems are just, it's almost there. Oh, it's almost there, you know it. So that's where it comes.
So those of you who are stocking up with dexamethasone, you really don't need to. From what the discussion I'm having. Okay, so we're wrapping up, but I want to find out for those who are asymptomatic, what kind of will doctors typically still prescribe hydroxychloroquine?
Yes, thank you very much. So yes, for asymptomatic they do. So they just look at the other comorbid conditions and other presenting conditions the patient has, and then they'll make a right choice for it or otherwise. But
I'm talking about people who are asymptomatic. They show no symptoms at all.
Yes, I'm talking about, yes, it might be asymptomatic as far as COVID is concerned, but it might be having symptoms of cardiac issues and other things, yes. So for asymptomatic, it is still used for hydroxychloroquine. Yeah, it's part of the protocol they use it.
I see. So how has the response been? I was asking you earlier.
Yes.
The feedback.
So the feedback has been great, but unfortunately people want it over the counter. People just want to get to us and just get it. We said no. For as long as it's a prescription medicine, we cannot just give it to you like that until a doctor and a good doctor prescribes it for you. Yes.
What checks are there to ensure that people don't abuse this and just get it over the counter? We know there are several prescription medicines that these days you can get over the counter.
So the FDA has in place a strict system of pharmacovigilance, where from time to time can ask you, let me see, you produce one batch of the product, so let me see how much is left. Okay, if you have consumed this quantity, I want to know where the product went to. So they will trace the distribution, and that will ensure that you are distributing the product right. That works, that works. Do you have any final words to share with us? Yes, so we just want to, on behalf of Elder Nana Motobin and the entire Tobinco Group, want to assure us that we have systems in place as a country, and the pharmaceutical industry is also well poised to support in that direction. So they should rest assured, they should stay calm, and they should just trust in what is in the system to manage the condition and the pandemic that we have been faced with. Okay, we hear you. Let's try and trust the system a bit more. I'm particularly interested in how we're able to send this across the country. I mean, Ghana to the world, hopefully, and we'll get there. Christopher Mensah is Deputy Managing Director for Marketing, Tobinco Pharmaceuticals Limited. They are the first country to produce in West Africa, you say, right? To produce hydroxychloroquine, one of the medicines used in the treatment of coronavirus. Thank you very much for coming once again.